The new director of the Maine CDC is now 5 weeks into her job as the state's leading healthcare professional. You may have heard that she graduated from medical school at the University of New England in Biddeford. What you may not have heard is the story of how she got back to Maine and why it is important to her to be here. Here's Chris Costa.
When I saw this position open up, I wanted to come back to Maine. I was like, I always knew I had to come back somehow and serve, because I felt like the community gave me something. I need to give them back something too.
This is Dr. Puthiery Va. The 43-year-old is now the director of the Maine CDC.
And so I feel like I understand those challenges.
It's a homecoming of sorts. She graduated from the University of New England's College of Medicine in 2012.
But no, I applied to 5, and my friend was like, you should really consider the University of New England, and I did.
And when you were there?
Never been to Maine before.
But she has lived in the United States almost her entire life. Almost.
And so when people ask me if I, where was I born, where did it come from? I was like, I guess I'm a refugee, like literally a refugee. I was born in a refugee camp. Mm-hmm.
A refugee camp in Thailand. Her mother, father, and older sister left Cambodia as the country fell into chaos and turmoil after the Communist Party, the Khmer Rouge, fell.
And they had to decide, okay, what do we do now? What future does this country, what future do we have here in its current state right now? And we have a daughter and a baby on the way, which was me.
From there, her family became asylum seekers, arriving in Elton, Louisiana. They moved to the inner city of Rochester, New York when she was 5 years old. Learning how to live in the U.S. was its own challenge.
And when you're in college, what do? What if you need help? What does an advisor do? It was like all these basic things that I did not grow up knowing.
She says growing up in an urban area helped her understand the disparities in health and health care.
Because you start to see, why is it so challenging? Why is it so difficult to live for a community to be healthy?
A similar struggle for people in rural areas, which she learned while serving in the Peace Corps in Burkina Faso in West Africa, and later leading the COVID-19 response in the Navajo Nation in Chinle, Arizona.
How do you isolate safely when you have 3 generations in a home? How do you take these infection control precautions when you don't have running water or electricity? And then how do you get good access to even schools, right? To work and learn when access to the internet is difficult.
A challenge people in Maine face too. So Dr. Va is touring the state to meet with healthcare professionals to learn where the pavement meets the dirt road.
Those are the questions I want to make sure that we're addressing. And a lot of times I look at it as a way of, okay, if these are the challenges, then how do we bring those services to the people? So it's more than just sometimes, yes, it is the physical, geographical, access issues. And then once you ask that question, why, then why not? Why can't we bring those things? Why isn't there a healthcare facility right there?
Realizing that the science of health is about much more than numbers and data.
So how do we make it just easier for people to find health all the time? And I feel like that's probably one of the challenges right now. How do we make that system much easier to navigate?
Chris Costa with our story tonight. Now, we also talked to Dr. Va about her priorities for addressing public health in the state. If you missed that conversation at 5:30, you can see it in the News Center Maine app.